There still seems to be a messaging problem. The week began with the CDC director, as you know, warning of impending doom, and then ending with the CDC saying it's fine for fully vaccinated people to travel within this country without tests or quarantines. Can you help us clear up the confusion? Do you agree there might have been a little confusion over the past week for people who are still wondering what is safe and what's not if I've been vaccinated?
Well, the point that Dr. Walensky was making earlier in the week when she made that statement was that the thing that we're concerned about, although, as I'll get to in a sec, things are going extremely well with regard to the vaccinations. But what we're seeing after that big peak that we had around the Christmas holidays and New Year's, when it started to come down, it plateaued at a disturbingly high level of number of cases per day. And one of the concerns we have is that when you plateau and then start inching up, as we are doing, as you mentioned just a moment ago, in a few of the states, in fact, several of the states, there's the danger, Jim, of having a resurgence and another big surge up. Like just yesterday, we had over 60,000 new cases in a day. That's disturbing. That's what happened in Europe and what is happening. And Europe, for the most part, is going through another disturbing surge. So the point she was making is we're not out of the woods yet, so don't declare prematurely victory because we're not there yet. That's the sobering news. The good news is what you mentioned just a moment ago. We're getting 3 to 4 now, that today was 4 million doses per day. So it's kind of like a race between getting people vaccinated, and the more people on a daily basis you get vaccinated, the better chance you have of blunting or preventing that surge that we're all concerned about. So it's, sobering news mixed with good news. And it's going to be really a race between those two. We would hope that throughout the country, we don't get that premature pulling back on public health mitigation methods, where we're seeing some states backing off on mask mandates, backing off on talking about congregate settings and restaurants and bars. We just got to be careful. We're almost there. We're getting there, but we're not there yet.
And here's another one that gets confusing to some people. The CDC had to walk back comments from the director that vaccinated people do not carry or transmit COVID-19. I think the big question that people have out there is if they're fully vaccinated, do they still need to wear a mask? What is your take on that, Dr. Fauci?
It's pretty simple to explain, but it's understandable how people can get confused. We know from the vaccine trials, the tens and tens of thousands of people, that the primary endpoints in those trials was whether or not the vaccine prevented clinically recognizable disease. It wasn't aimed at determining whether it prevents infection. So you could conceivably get a really good 94-95% protection against any clinically recognizable disease and still have some people get infected without any symptoms. So the question is, that being the case, if we're not sure of that right now, it is conceivable, maybe likely, that some people will get infected who are vaccinated, not realize it because they don't have any symptoms, and inadvertently spread the infection to someone else. It was for that reason that masks are still recommended for people who are vaccinated. Having said that, as the weeks go by and we get more and more data, and it accumulates literally on a daily basis, it becomes clear that vaccinated people have a much, much lower level of this breakthrough asymptomatic infection, namely an infection that you don't notice because you don't have symptoms. When you compare vaccinated people who get infected like that versus unvaccinated, major difference in that there are far, far fewer vaccinated people. Then when you look at the vaccinated people who've had breakthrough infections, the level of virus is much lower in their nasopharynx than the level of virus in people who were not vaccinated, who developed infections that were without symptoms. So it's looking like the data are gradually getting to the point where it's going to be an extremely low likelihood that a vaccinated person will be able to transmit to a person who is unvaccinated and not infected. We haven't nailed that down completely. We've started a college study among 20 colleges vaccinating people and determining if they can pass it on to their close contacts. When we show that they don't, and I believe it's going to show, and I don't want to get ahead of the study, but I wouldn't be surprised if it showed that vaccinated people do not transmit infections to others, even when they have asymptomatic breakthrough infections.
And
when
a lot
those
of that
data come in, Jim, then yeah, you're going to see a turnaround in the recommendation. So the
Right, that's what
recommendations are being careful and conservative right now.
A key model used by the White House estimates an additional 61,000 people will die between January 29th and, March 29th and July 1st. Trump is gone. There is no Scott Atlas. It's President Biden. He's leaving the scientists in charge, scientists like yourself. So if you had your way, what would you do to prevent further deaths? If some of these deaths could have been prevented during the pandemic, what more could be done now to make sure we aren't looking back and saying, gee, I wish we didn't lose X number of people?
All right, so I look at it now. So take now, looking forward X number of weeks and say, okay, it's in our purview now, it's in our ballpark. The two things that you do: A, you keep pushing down and doubling down on public health measures. And B, you do whatever you can to get as many people vaccinated as quickly and as expeditiously as possible. The second, you just mentioned on the top of our segment, Jim, that we're doing in record time. 4 million people vaccinated is really a lot of people. If you multiply that by 30 days in a month, you've got 120 million vaccinations that you've done. That is what you need to get your arms around this outbreak and to prevent additional deaths, additional hospitalizations, additional infections. The other one is doubling down on the public health measures. And you hear the president explicitly getting out there and saying, let's not declare victory prematurely. So it's up to people to realize, and we say it over and over again, and we need the local people, we need the governors and the mayors and others to be able to say, we're not out of it yet. People say, well, you just want to confine us forever. No, this is not going to last forever, because every day that you get 4 million, 3 million people vaccinated, you get closer and closer to control.
No
so
question.
What we're saying is double down, just hang in there a bit longer, and the vaccine and the vaccinations of people in this country are going to override the surge of the virus. There's no doubt
I hear what you're saying,
the
Dr. Fauci,
vaccine is going to win out. Yeah.
Let me just interject, if I may, because our Evan McMorris-Santoro was in Times Square earlier today talking about how they're reopening some things in New York City. We saw images just a short while ago. Here are some live pictures right now of Times Square in New York City. It is jam-packed full of people, Dr. Fauci, in Times Square. People are out there. Yes, many New Yorkers are doing the right thing. They're wearing masks and so on. God bless them for doing that. But as you know, because Dr. Fauci, I know you live in the D.C. area just like I do. We are starting to see traffic again. We are starting to see lots of people down on the National Mall to look at the cherry blossoms. It seems like people are starting to say, you know what, I am tired of this. I am done with this. I am getting my vaccines. And so how do we prevent a new surge of cases if people have just said, that's it, I'm done. Dr. Fauci is a nice man. I like listening to him and so on. But I'm ready to move on and move on with my life.
It's not easy, Jim, because this COVID-19 fatigue is a real phenomenon, and people are feeling it. We're now 14 plus months into this, and it's totally understandable that people have had enough of it. So what we're saying, and we hope that to some extent, or maybe to a large extent, they listen, that we are going to get to where they want to be, where I want to be, where you want to be, where we have enough people protected with the vaccines that we can go out and watch the cherry blossoms, and we can go out and enjoy as we get warmer weather. It's going to happen. It will.
But do you think the recommendations from public health experts like yourself in the White House are in touch with the reality on the ground in places like Times Square and the National Mall, where you have people going out there and doing?
I'm not sure. Jim, I'm not sure there's much more we can do, but to try and get people to appreciate But the thing we can do is what we're doing with the vaccines. We're really, really pushing on that. And you know, there was an announcement a couple of days ago about the COVID-19 community core, where we're essentially engaging trusted messengers from the community, be they people who are trusted church leaders, clergy, athletes, entertainers, people in the community, to get people to get out there, and when vaccine becomes available to you, to get vaccinated. I agree with you completely, Jim. It's a tough sell to get people who have COVID-19 fatigue to just continue to abide by the public health measures. It's not going to be easy. I hope we have a degree of success. But in the meanwhile, you and I are talking about this, but every day, 3 to 4 million people are getting vaccinated. That is going to be the solution, Jim. That's the solution.